A day after the budget books were opened, ministers hit the road to sell their wins to the public.
But one of the big spends is causing a standoff: free prescriptions. Furthermore, the government has also set itself a new target for reducing surgery wait lists. Here's political reporter Amelia Wade.
After working out what goes where,
very good, well done.
The PM gets to spread the word about who gets what.
You a chatbot.
While the Finance Minister dines on the post-budget high.
This is an attempt by us to bring us back to slightly more normal levels of government spending following on from COVID.
Be under no illusion, spending is going harder and becoming more intense and stronger.
One big spend squabble is over the $150 million a year to make prescriptions free.
I don't think it makes a lot of sense that someone like me gets the benefit of free prescriptions. I think if I can pay, I should pay. Do you know what I mean?
Well, it's difficult to know what the National Party's position is on prescriptions. Yesterday they were saying they were going to reintroduce the prescriptions. Today they're saying they're going to target them.
I think targeting it to people with community services cards, for example, targeting it to people with gold, super gold cards.
Free prescriptions and 500 more nurses were among the budget offerings for a creaking health system.
For years it made me not feel heard and it made me not feel valued.
Perepita has had a mixed experience with the health system.
I think a lot of people don't like hearing it, but a bit of racism.
We asked in our latest Newshub-Reid research poll, are you confident you would promptly receive the care you need in the healthcare system if you were to become ill? And the majority, 50.7%, said no, while 41% said yes.
Makes me determined to show them that we can do better, and we will.
Sometimes you can be waiting up to 3-4 hours in the emergency room. I understand that, there's staff shortages and stuff, but it's hard out there at the moment.
Waits are too long in every corner of the health system. By the start of 2023, the number of Kiwis waiting more than a year for surgery had blown out to more than 6,000 people. Yesterday, $118 million was allocated to reduce waiting lists, and the government's given itself a new surgery target. By 30 June 2024, it expects no patients to be waiting longer than 12 months for surgery from the date a treatment decision is made. But this goal does not include orthopaedic patients who need hips and knees.
So if you're a patient who's referred into the hospital services in July of this year, it could mean a wait of up to 2 years to be seen.
We've clearly got work to do around reducing our waiting lists, and I know that Te Whatu Ora are very, very focused on that.
While the Prime Minister is focused on showing off the shiny bits of the budget.
OK, Amelia, so what difference will the free prescriptions make?
Not only does it level the playing field for the smaller pharmacies who are up against the big dogs offering the free prescriptions, but the government's identified 153,000 Kiwis who didn't fill prescriptions because of the cost. And when you get the medicine that you need, you're less likely to end up at a GP or in a hospital with an avoidable illness, and that should ease pressure on the system. But it is not just the elderly or the unwell who regularly fill prescriptions. It's women on contraception, and that $5 fee is either a barrier or just a real annoyance. The free prescriptions kick in from July 1st, so what Labor's done is backed National into being the party that has to campaign on making women pay for their contraception prescriptions again. Coupled with the extension of the 20 hours free of ECE, this prescription play is all part of Labor's layered manoeuvres for the women's votes.
Amelia Wade, live at Parliament. Thanks very much for the analysis.